Hello, dear friends. I am Dr. Jambukeswaran, PrepLadder's Orthopedic faculty for you. We are going to do a short recall of our NEET PG exam, which was over yesterday. Okay, dear guys, am I audible? Just give me a thumbs up thing. Am I audible? Am I visible? Hello, anybody? Hello, anybody? Hello. Yes, Siddharth Sharma. Thank you very much. Yes, Tammy Gupta. Yes, sir. Thank you. Thank you very much. Yeah, we will start. See, just before starting, I have to announce you one thing. We are going to launch our English version of Rapid Revision on 16th August this month, 16th this month, and it will be very useful for you. Apart from your regular videos, rapid revision videos of around 260 hours plus, you will get 2500 high yield MCQs covering most important topics, and you'll get a concise notes for this. Straight away, we will move on to the first question. As I said, no, these are all recollected questions from our students, and they had, first of all, we thank our students for giving the questions. Right, we'll move on to the first question, dear guys, and I hope all of you would have done well. Okay, so how was the exam? Siddharth Sharma, how did you do? How do you feel about the paper? Was it tough? I had gone through the question in my thing. I know the ortho questions. It's okay. It's okay. All right. Except one or two questions, it's okay. All right. Yes, we'll move on to the first question. Which classification is used for the following fracture, and what is the stage? Stage means they are asking what's the grade. See, I am able to see a supracondylar fracture. I am able to see a supracondylar fracture. The fracture, yes, easy to moderate session. Siddharth Sharma had given the question is easy to moderate. You are right. Okay, so let us see. Okay, we will crack, guys. Don't worry. We will crack. Don't worry. See, I am able to see a supracondylar fracture, and when I see this, the fracture, the proximal fragment, the distal fragment is totally displaced. It is totally displaced. We know the classification system for supracondylar fracture is Gartland. There is no doubt. Gartland. Okay, there is no doubt. Salter and Harris is the classification system for epiphyseal injury. Gartland is the classification system for supracondylar fracture. So what grade is this? You just recollect all these things in our YouTube videos. It's there. In our regular videos, it's there. Very simple. See, type 1, type 2, type 3. There are only 3 types of Gartland. Type 1, fracture is incomplete. Type 2, fracture is complete. Only the anterior cortex is displaced, posterior cortex is intact. Type 3, it is complete and totally displaced. When you see here, it is complete and totally displaced. So the answer should be Gartland's type 3. That should be the answer. Salter and Harris is the classification system for epiphyseal injuries. It is into 6 types now. The Salter and Harris is no more Salter Harris. It is Salter Harris and rank classification. Type 1, 2, 3, 4, 5 and 6. Okay. So no need to go in much detail into Salter and Harris type now. Right. So this is Gartland's type 3. We'll move on to the next MCQ, dear guys. An 8-year-old male child presented with fever, tenderness in the left lower limb. The limb, when you touch, it's warm. The ESR is raised. Marker is raised. X-ray reveals the following thing. It's a 8-year-old child. In the X-ray, I am able to see here, when you able to see here, there is a periosteal elevation. There is periosteal elevation. Common things common. Okay. So the diagnosis is, it should be osteomyelitis. Diagnosis should be osteomyelitis. It should be a case of good moments. It was 18 years, sir. Okay. So good moment says it's 18 years. Okay. Even when you take 18 years, common things, no? See, you will be in a doubt. You will be in a doubt that whether it is Ewing's sarcoma or osteomyelitis. Ewing's sarcoma, pain will be there, but other symptoms are rare. And moreover, if it is Ewing's sarcoma, the thing should be onion peel appearance. The thing should be onion peel. The multiple layers of stripped periosteum should be there. Okay, so surgeon Sutriya, extremely clear, and sun-ray appearance was extremely visible, as well as Codman's triangle. Okay, surgeon Sutriya said, sir, so probably this x-ray, this is what I got, it should be. And if it is classical sun-ray appearance, okay, Shivani's sun-ray appearance was clearly visible, sir, then it's okay. Shivani, okay, Shivanya, okay, Shivanya, then its sun-ray appearance is clear, means then the answer should be osteogenic sarcoma. Answer should be osteogenic sarcoma. Okay, it should be osteogenic sarcoma. Sun-ray appearance is clear means the age 18 years, it's okay. Then they should not use the word this child. I don't know why this word 18 years is not a child. Okay, so 18 years old male presented with history of fever, tenderness in the lower limb, warm on touch, ESR is raised, and the X-ray shows sun-ray appearance, then there is no doubt it should be osteogenic sarcoma. Yes, excellent. We will move on to the next question. Identify the implant. This question have been repeated twice because, dear friends, two different papers. Few questions overlap may be there. Morning session, afternoon session. Okay, so there may be overlap. Okay, there may be overlap. Right? Yes. Yes, Ravi Inder Singh, periosteal elevation seen. Right. Okay. You see, classically, this question have been repeated twice, dear friends, and what this shows, this is a classical dynamic hip screw. This implant is the classical dynamic hip screw. Dynamic hip screw, yes, very good. Raju Bukhaya have answered it correctly. Dynamic hip screw, classically this is dynamic hip screw. Dynamic hip screw is a very good treatment for intertrochanteric fracture. Intertrochanteric fracture is divided into stable and unstable. If it is a stable intertrochanteric fracture, the treatment of choice is dynamic hip screw. There is nothing called a dynamic hip screw. Dynamic condylar hip screw. There is a condylar hip screw. What is the difference between dynamic hip screw and condylar screw? It will look like this, but you see here this angle, no? This is 135 degrees. This plate is called 135-degree plate. If it is dynamic condylar screw, the plate will have an acute thing like this, not 135, more than that. The angle will be, it is not like this, the plate will be like this. Then that is called dynamic condylar screw. So this is undoubtedly, clearly this X-ray is dynamic hip screw. Okay, right. See, intramedullary nail is the treatment of choice for shaft of femur, shaft of tibia, not here. Okay, so this should be one option, temporary contact plate screw. Contact plate screw is not used for trochanteric fracture. It's not used for, so clear cut, identify the implant. The right answer without doubt is DHS, dynamic hip screw. We'll move on to the next thing. A patient presents with fifth metatarsal fracture. How long she should be given POP cast? That's the question. When you see here, I am able to identify a fracture here. This is called Jones fracture. This is called Jones fracture. This is called Jones fracture. Right? What is there is one more thing which is called, it's a pure classical sunburst appearance. Okay, many are telling sunburst. For that, it should be osteogenic sarcoma. Right? Good. See, Jones fracture and pseudo Jones. What's the difference? Pseudo Jones happens here. Okay, it should be intra-articular. Jones is extra-articular. Okay, it is extra-articular. Jones is extra-articular. Okay, pseudo Jones means it's intra-articular. Pseudo Jones many times may need surgery. Jones fracture always POP. How long it should be immobilized? It is there in our notes. We have done this already. It should be given for 6 to 8 weeks. Okay, the right answer, it should be given for 6 to 8 weeks. Right. Sajan Sutriya asked a question even because I had a doubt. Osteosarcoma, can it happen in diaphysis? That's the question they are asking. Osteosarcoma, it should happen mainly in metaphysis. 90% time it can happen in metaphysis. Diaphyseal extension is always possible. Ewing sarcoma is diaphyseal tumor, but it won't give a sundry appearance because everyone accepts that in that exam clear sundry appearance was there. Sundry appearance means it should be osteogenic sarcoma. Okay, again osteomyelitis, it's a disorder of only metaphysis. It can happen in diaphysis also. Okay, so right, so this is 6 to 8 weeks. That's the right answer. Minimum 8 weeks is needed for Jones to unite because it's weight bearing. Now you see, right, you see here a child presents with growth failure. Biochemical analysis shows normal calcium. Calcium is normal parathormone, reduced phosphate, increased alkaline phosphatase. Directly, the 4 choices are here: nutritional rickets, hypophosphatemic rickets, type 1 vitamin D dependent ricket, type 2 vitamin D dependent ricket. Phosphate is low, calcium is normal, it should be, and alkaline phosphatase is elevated, it should be hypophosphatemic rickets. This should be the right answer. Okay, right, this is called renal rickets or resistant rickets and X-linked, and the book says that when you read pediatric textbook and ortho textbook, nowadays they are telling nutritional rickets. In our country, the common cause is nutritional. Worldwide, the common is hypophosphatemic. So that should be the answer. And you see here, Dr. Light has given the right answer. Dr. Light, what a name. Yes, excellent man, super. You see, hypophosphatemic rickets. So the patient has genuvalgum. It should be a case of hypophosphatemic rickets. Right, in hypophosphatemic rickets, calcium is normal. Parathormone can be normal or sometimes slightly elevated. Phosphate is always low. Alkaline phosphatase is always high. Okay, this is, we will move on to, sharply we will move on to, sir, in question Q, shift to 2 question, DHS healing was asked primary callus. I am having that with me, man. Okay, who is that? Junior surgeon. Hello, junior surgeon. I am having the question with me. It will come. Please wait. Yes. You see, a heavy lifter presented with lower backache referred to back of the thigh and leg. Identify which nerve gets compressed. That's the question. You see here, I am able to see this is sacrum. This is sacrum. This is L5. This is L4. And I am able to see a disc bulge between L4 and L5. So I am able to see a disc bulge. We all know the rule. When there is a disc bulge in thoracolumbar vertebra, it compresses one nerve root down below. Other way around, if there is a disc prolapse in cervical area, it compresses the nerve root above. This is the general rule. So this is a lumbar disc prolapse, and lumbar disc prolapse is seen between L4 and L5. So it should compress L5. This is the picture I got. If it is between L4 L5, so the nerve root that is compressed is L5. Okay, nerve root that is compressed is L5. Okay, yes. Now we will move on to the next question. A man presents with back pain following road traffic accident. There was no history of neurological deficit. No neurological deficit. An X-ray spine is given. The diagnosis, what is that? And they had given an arrow. You are able to see the spinous process. Fracture of the spinous process. Fracture of the spinous process. Fracture. What do you mean by chance fracture? Okay, what do you mean by chance fracture? Right. Right. What do you mean by chance fracture? Right, yeah, spinous, Dr. Light has given the right answer. Superman. Chance fracture is fracture of spinous process, pedicle and vertebral body. So 100% chance fracture or unstable fracture, they will present you with neurological deficit. You see here, there is no neurological history of there was no history of neurological deficit. So chance fracture is ruled out, and definitely it is not fracture base of the, and there is no, I am not able to see any wedge compression here in this X-ray. Okay, good. So this should be a spinous process fracture. This was an asked question. I don't know in which session it came, morning or afternoon, I don't know. A football player had twist in the ankle and knee. A football player has twist in the ankle and knee. Okay, and clinically no bony injury. Examiner is doing a test. What is that? Okay, football player just twisting. The most common thing to get injured is anterocruciate ligament, and they had shown, if this is the picture, this is the picture I got. This is the picture I am able to see. The knee is bent to 20 to 30 degree flexion only, not 90 degree flexion. 20 to 30 degree flexion, and the examiner is not sitting over the foot. So this should be a Latchman's test. This should be a Latchman test. If it is right, if it is anterior drawers, the knee joint should be flexed to 90 degree. Examiner sits over the foot and will give a thing. When the knee joint is flexed only to 20 to 30 degree, it should be Latchman's. It should be Latchman's. Okay. So this is the answer. And we have discussed this several times in a YouTube session and in our main videos. Latchman is always superior to anterior drawers because of doorstep phenomena. Just recollect, go back and see. Okay, with diagrams, I had explained this. This is very simple. Then comes identify the X-ray. Okay, identify the X-ray. What is the thing? I am able to see here, this is an X-ray of a child because the epiphysis is not closed. So we are dealing with an X-ray of skeletally immature patient, and I am able to see here a lesion. That this is called traction apophysitis or traction epiphysitis injury of the tibial tuberosity, and that is called Osgood-Schlater's disease. That's called. Okay, we have seen when the same thing happens in, if it happens in the tibial tuberosity, it's called Osgood-Schlater's disease. And they had given a closed choice tibial tuberosity fracture. Tibial tuberosity fracture. Since the epiphysis is not closed, okay, yes, okay, call duty has answered. Osgood-Schlater's was not in the option. Priya Saha, A was not a separate option. Jomo Medical, it was not in the option. If Osgood-Schlater's is not in the option, is Osgood-Schlater's not in the option, the answer is tibial tuberosity fracture. If that is not there in your option, then there is no doubt the answer is Prashant Kumar Mohapatra. Sir, he was asking the name of position of the lesion. Yeah, then it is tibial tuberosity. If they ask what is the position, where is the lesion, if they ask and this is the image, it is there in the tibial tuberosity. Right answer should be tibial tuberosity. This is not. Tibial tuberosity is your answer. Okay, we will move on to the next. You see, what is the device shown in the same thing following intratrochanteric fracture? It is dynamic hip screw. It is dynamic hip screw. Okay, yes. Linear growth of the bone is disturbed when fracture occurs in. Which part is damaged when fracture happens in epiphysis, diaphysis, metaphysis, epiphyseal plate? Epiphyseal plate is otherwise called growth plate. This is otherwise called growth plate. Okay, growth plate. So linear growth of a bone is affected whenever there is a fracture in the epiphyseal plate or growth plate. Definitely that will cause growth arrest. And the classification is called your Salter and Harris growth arrest. Okay, so that should be the right answer. We'll move on to the next. O sign by thumb. Okay, by which muscle? O sign. Okay, this is called O sign by thumb. We'll check this in our median of policy. This is because of your opponent's pollicis. Okay, O sign by thumb and index finger affect which muscle has been injured? Opponent's pollicis. Okay, it should be opponent's pollicis. Yes. Tuberosity only. Okay, right. Then thenar eminent sensation is lost. Lateral third finger sensory loss is there. Injury happens what? Definitely this is an injury of the sensory supply of the median nerve that's proximal to the carpal tunnel. So carpal tunnel is there in the choice. So this should be, because at higher level median nerve injury happens in the higher level. Patient should be having all other Osner's clasp hand, okay, right, pointing index, all other things will come. There is just sensory loss over the thenar eminence and over the lateral 3.5 digits. Definitely, it should be the level of compression just proximal or at the level of carpal tunnel. Okay, carpal tunnel. So this should be the answer. And this is the question. You asked, no, who was asking name of the push making. So somebody was asking, no, the plate was given and what type of healing it has happened. That's what you are asking, no? A rigid plating was done. A rigid plating was done. What kind of bone healing can happen? It should be primary bone healing. It should be primary bone healing. Primary callus or primary bone healing means it can happen only with rigid internal plating. Callus formation is very inferior. Callus formation is very low. Only bridging callus happens. External callus won't happen. Secondary bone healing follows plaster of Paris. Your natural healing with plaster of Paris is secondary healing. There excessive external callus will be there. All the classical stages of your stage of impaction, stage of induction, stage of hematoma formation, inflammation, soft callus, hard callus, consolidation, all the classical Hunter stages will happen only in secondary healing. Primary healing, there won't be much of callus. Book says absent callus. In a standard textbook uses the word absent callus. That means he is meaning no external callus is there. So X-ray shows plating is done. That is called primary healing. In general surgery, everywhere it is callus. Yeah, Guntur, Monu, it's called callus. Primary healing or primary callus. That should be the answer. Primary is the answer. I want to tick the word primary. Whenever plate is there, it's called primary. That's all. Okay. You see here. I said that in all other systems, for example, general surgery, primary healing is superior. In orthopedic, secondary healing is superior because the healing happens with lot of callus and the unity, that fracture healing is very strong in secondary. The only advantage of primary healing is good anatomical reduction, early mobilization. Okay, yes. We will move on to the next thing. Identify. They had given like this. And they ask what is that. When you see very carefully, I am able to see the L5 and this is S1. L5 is projected forward. So this is a case, you should be a case of spondylolisthesis. Spondylolisthesis L5 over S1. L5 over S1. Okay. Yes, L5 over S1. Right. Good. Yes. And coming to this, classically they had given a picture like this and they asked what is this? This is the classical cubitus varus deformity. Cubitus varus deformity. This is otherwise called gunstock deformity. Gunstock deformity, which classically happens in a malunited supracondylar fracture. Okay. Is to abductor. No. It is due to opponent's policies. Okay. So yes, high median nerve injury, right. So these are the questions. This is a classical gunstock deformity and it follows a malunited supracondylar fracture, right. Right, to some extent whatever thing input I have got, we had discussed. I hope you have done the session well, you have done the exam well. All the best, dear guys. Okay, see, this was a long pending exam. March this should have happened, so postpone. Finally it has happened yesterday. Just you relax now. They are telling the results will be out in very few days. It will come. Let it come. We have done our job. And I am telling God is there with us, and definitely we will have success. Okay, with a positive attitude. I close this session. All the best, dear guys. Okay, just relax. Thank you so much.